Welcome back. Today we're doing a deep dive into something pretty fascinating. How scarcity can, well, actually force innovation.
That's a great starting point.
Yeah, think about Estonia. They had limited resources, right?
Right.
But instead of just, cutting corners, they completely rethought how to deliver public services.
Absolutely. Especially healthcare. They use digital tools not just to save money, but to build something really efficient and actually quite citizen-focused.
So it wasn't just about IT projects, it was more fundamental.
Exactly. It was a strategic nationwide shift, a total digital transformation, really. And it all started with this idea of e-governance and a strong digital ID.
EID. Okay, so that's not just like a login.
No, it's much more. It's the bedrock. It lets citizens securely access all sorts of services online, and crucially for us today, their healthcare.
And the core of that healthcare system is, what was it called? The HIS.
That's right. The Central Health Information System, HIS, launched back in 2008.
2008, wow.
Yeah, and you can picture it like a secure digital vault for all your health info, doctor visits, prescriptions, lab results, hospital stays, everything.
All in one place.
Digitally, yes. But here's the really clever bit, the thing that sets Estonia apart. It's not just about having the data there. It's about how that data is accessed and shared, securely, controllably.
Right, because a big central database,
Yeah.
that sounds a bit risky, doesn't it? Like one single point of failure or attack.
Precisely, and that's why they developed something called X-Road.
X-Road. That sounds intriguing.
It's the real game changer here, and it's super important to grasp this. X-Road is not a giant central database.
Okay, not a database. Then what is it?
Think of it more like a secure, decentralized data exchange layer, maybe like a digital switchboard.
A switchboard. Okay, I think I follow.
It allows all the different systems, hospitals, labs, pharmacies, government agencies, to talk to each other securely.
Ah, so the actual health data, the sensitive stuff, it doesn't get copied and dumped into one huge central file.
Exactly. It stays where it was originally created, in the hospital system, the lab's database, wherever.
And the benefit of that is?
Well, huge benefits for security, for one, and transparency.
Right.
So if a doctor needs your records, X-Road creates a secure, authenticated path for them to fetch just that info in real time directly from the source. X-Road acts like a gatekeeper, checking who's asking and what they're allowed to see for every single request.
Okay, let's make this concrete. Say, I see my regular doctor, then I need a specialist in another city. That specialist.
Yeah.
Can they just pull up my whole history? Allergies, past treatments, everything. Even if they use totally different software.
That's exactly it. In real time, that interoperability, it leads to much, much better decisions, more coordinated care.
Yeah, you're not relying on the patient remembering everything or carrying around stacks of paper.
Precisely. The key info is securely available to the right people right when they need it.
So it clearly empowers the doctors, the providers. But you mentioned citizen-centric earlier. How does this system focus on the individual?
That's absolutely central to Estonia's philosophy. The core idea is, it's your health data. You own it.
Yeah.
And this is where the patient portal comes in. Every Estonian citizen can access it using their EID.
And what do they see in this portal?
Pretty much their entire health journey. A single view pulling together records from all different providers. Consultation notes, meds, even bills.
Wow.
And here's something quite powerful. They can see a log, who accessed their data and when.
That level of transparency is, well, it's pretty uncommon elsewhere.
It really is, and it goes further. Patients have control. They can grant access or deny it to specific doctors, even family members.
So you're genuinely in the driver's seat with your own information.
Completely. It puts the individual firmly in control.
And I heard it's quite user-friendly too. Like everyone gets a digital record from birth.
That's right. Every citizen is registered with a family doctor automatically, and the digital record starts then. And accessing it often is just your national ID card.
So you don't need to be a tech whiz.
Not at all. It's designed to be accessible. And this combination, easy access, transparency, control, that's what built public trust. It empowers people to manage their own health better.
No wonder Estonia is seen as such a benchmark. Other countries must be looking closely.
Oh, absolutely. Their adoption rates are high. The security record is strong, especially with X-Road underpinning it all. Canada, for example, has specifically studied Estonia's model.
Right, which kind of brings us to Trinidad and Tobago. they're at a different point, aren't they? More foundational work happening now.
Yes, exactly. They're working on the legal side, the physical infrastructure, while also pushing ahead with digitalization. They actually secured a big loan recently from the IDB
For what, specifically?
for a National Electronic Health Information Management System, EHIMS, they're calling it.
EHIMS, okay. And the goal there is,
The goal is to create a standardized electronic health record, something that connects the different regional health authorities, the Ministry of Health, basically create a unified digital network.
so that standardized record is the base layer.
Exactly. It's the foundation for whatever comes next in their digital health journey.
So if Trinidad and Tobago looks at Estonia's success, what are the logical next steps drawing from that experience?
Well, the first and maybe the most crucial step would be building that interoperable backbone. Just having the EHIMS isn't quite enough.
Right.
They need to implement X-Road principles, maybe use X-Road technology itself.
So connect the EHIM systems together using something like X-Road.
Precisely. Create that secure data exchange layer to link up systems that are probably quite fragmented right now.
Okay, so it's not just about having electronic records, but making them talk to each other securely.
Yes. Achieving that seamless data flow, that's the big leap. Imagine EHIMS, plus that X-Road style interoperability.
What would that enable day to day?
Well, smooth, secure sharing of records, lab results, histories. Think fewer duplicate tests for patients. Much better continuity of care if you see different doctors.
Makes sense.
And faster response in emergencies, right? Quick access to critical info like allergies or conditions.
Yeah, that could be life-saving. And beyond sharing data between doctors, what about using the data itself?
Huge potential there, too. EHIMS, if done well, generates real-time quality data,
Four kinds of things.
improving individual care, obviously, but also public health surveillance tracking disease outbreaks, for instance, making smarter decisions about where to put resources in the health system, promoting evidence-based medicine across the country.
And the citizen empowerment piece, like Estonia's patient portal.
That would seem like a very logical and beneficial next step for Trinidad and Tobago.
So giving citizens access to their own records?
Yes. A secure portal inspired by Estonia's, where people can see their records, prescriptions, maybe bills, and crucially, potentially control who gets access. That really boosts transparency and engagement.
It sounds incredibly promising, but transformations like this, they must face hurdles.
Oh, absolutely. Big ones. Trinidad and Tobago will likely face challenges similar to what Estonia probably went through.
Such as?
Integrating old legacy systems, that's always tricky. Ensuring reliable internet everywhere, even in more remote areas, that's critical for TNT's geography.
And funding, buy-in.
Definitely. Securing ongoing funding, getting everyone on board, doctors, nurses, administrators, the public, and of course, nailing data privacy and security. That's non-negotiable. You have to get that right.
So it's much more than just the tech.
Much more. You need strong collaboration across government, healthcare, IT, big investment in infrastructure, training for staff, clear laws and rules about data, maybe even unique patient identifiers to make sure data links correctly.
Yeah.
And Estonia's success, especially with X-Road and that citizen-first mindset, it provides a powerful blueprint. It shows what's possible.
So if TNT focuses on building that strong, secure, interoperable foundation,
They have a real shot at creating a future where healthcare is just, well, better coordinated, more accessible, and more transparent for everyone there.
So, wrapping up our deep dive today, the key takeaway seems to be Estonia's really innovative path. Facing limits, they built this decentralized, secure, citizen-controlled digital health system using X-Road.
Yeah, and it shows the potential benefits for any nation, really.
And we've traced that journey from Estonia's initial challenge to the potential steps now facing Trinidad and Tobago. Lots of lessons learned there.
It's fascinating to see that progression, isn't it? How constraints can genuinely spark invention, especially when you keep the end user, the citizen, firmly in mind.
It really makes you think, doesn't it? What other complex problems beyond healthcare could we tackle using similar digital, citizen-focused, maybe even X-Road-inspired approaches? Something to ponder.